Unit 3, Typology of Learners with Special Needs.
There are many different kinds of learners inside the classroom. One of these kinds of learners are the learners with special needs. A learner has a special educational needs if they have a learning difficulty or disability which requires special educational provision.
So first, let us talk about the learners with intellectual disability, specifically the learners with cerebral palsy and trisomy 21.
Cerebral palsy. It's pretty well established that your brain is really important. It's like if your body was a computer. Your brain is the mainframe. Controls everything whether you're aware of it or not. Cerebral palsy means brain disease causing paralysis. Also refers to a group of disorders affecting person's ability to move. So, it's a disorder that manifests shortly after birth. Essentially, cerebral palsy refers to damage to the brain that causes loss of muscle control. It is due to damage to developing brain either during the pregnancy or just after birth. There's three important parts of the brain which is important to know when dealing with cerebral palsy, and these three areas are the cortex, which is essentially the brain itself, the basal ganglia within the brain, and last, the cerebellum. Types of cerebral palsy in childhood or in general can be classified into four sections. First is the spastic cerebral palsy. It is common type of cerebral palsy. It affects about 80% of people with cerebral palsy. But according to affected limbs, plegia or paresis, meaning paralyzed or weak, can be classified into four sections. It affects both legs with slight involvement elsewhere, and it may also have contractures of hips and knees and talus equinovarus or club foot. And next is hemiplegia. Hemiplegia affects limbs on only one side. Hemiplegia on right side. Hip and knee contractures, talus equinus or tiptoeing, so permanently flexed. Astereognosis may be present, inability to identify object by touch. And next is quadriplegia. Sticks, scissors, or positions of lower limb due to adductor spasms. Last is triplegia. Triplegia affects three limbs. This is extremely rare. And next is dyskinetic cerebral palsy. People with dyskinetic cerebral palsy have problems controlling movement of their hands, arms, feet, and legs, making it difficult to sit and walk. And the third is ataxic cerebral palsy. People with ataxic cerebral palsy have problems with balance and coordination. They might be unsteady when they walk. They might have a hard time with quick movements or movements that need a lot of control, like writing. They might have a hard time controlling their hands or arms when they for something. And last is the mixed cerebral palsy. Some people have symptoms of more than one type of cerebral palsy. The most common type of mixed cerebral palsy is spastic dyskinetic cerebral palsy. And next is trisomy 21. Trisomy is also a type of Down syndrome. First, what is Down syndrome? Down syndrome is a genetic disorder. It also called trisomy 21. It includes certain birth defects, learning problems, and facial features. A child with Down syndrome also may have heart defects and problems with visions and hearing. How severe or mild These problems are varies from child to child. Down syndrome is one of the most common genetic birth defects. It affects about 1 out of 800 babies, but in adults with Down syndrome may live about 60 years. What causes Down syndrome in a child? When a sperm with 23 chromosomes fertilizes an egg with 23 chromosomes, the baby will then have a complete set of 46 chromosomes, half from the father, half from the mother. Symptoms can occur a bit differently in each child. They can include eyes that slant upward, small ears that may fold over slightly at the top, small mouth that makes the tongue appear large, small nose with a flattened bridge, short neck, small hands with short fingers, short hands, and loose joints. But most children with Down syndrome will have some, but not all of these features. Down syndrome can also include heart defects, vision problems, intestinal problems, hearing problems, thyroid condition such as leukemia, and learning problems. And next is how is Down syndrome treated in a child. There is no cure for Down syndrome, but a child with Down syndrome may need treatment for problems.
Then the second are the learners with learning disability.
Learners with learning disability. Learning disability affects the way a person understands information and how they communicate with other people. Having learning disability means that people find it harder to learn such a new certain life skills. The problem experienced vary from person to person, but it may include aspects such as learning new things, communication, managing money, reading and writing, and learning personal care. There are 3 types of learning disability. First, we have dyslexia, dysgraphia, and dyscalculia. Dyslexia. It is a learning disorder that involves difficulty in reading due to problems identifying speech, sounds, and learning how they relate to letters and words, also called the reading disability. Dyslexia affects areas of the brain that process language. Signs that a young child may be at risk of dyslexia include late talking, learning new words slowly, problems forming words correctly such as reversing sounds in words or confusing words without sounds alike, problems remembering or naming letters, numbers, and colors, difficulty learning nursery rhymes or playing rhyming games. Dysgraphia is a neurological disorder of written expression that impairs writing ability and fine motor skills. It is a learning disability that affects children and adults and interferes with practically all aspects of the writing process, including spelling, legibility, word spacing and sizing, and expression. These are the signs of dysgraphia: trouble forming letters, shapes, tight, awkward, or painful grip on a pencil, difficulty following a line or staying within margins, trouble with sentence structure or following rules of grammar when writing but not when speaking, difficulty organizing or articulating thoughts on paper. Dyscalculia. It is a difficulty in doing math problems, understanding time and money, and remembering facts. It is a math learning disability that impairs an individual's ability to learn number-related concepts, perform accurate math calculations, reason and problem solve, and perform other basic math skills. Dyscalculia is sometimes called the number dyslexia or math dyslexia. These are the signs of dyscalculia: difficulties with processing numbers and quantities, trouble recalling basic math facts, difficulty linking numbers and symbols to amounts, trouble with mental math and problem solving, difficulty making sense of money and estimating quantities, difficulty with telling time on an analog clock, poor visual and spatial orientation, and difficulty immediately sorting out direction. Learning disabilities is lifelong condition that have no cure. Treatment for this focuses on interventions, accommodations, and special services for the learners having this disorder.
Then third are the learners with physical disability.
Students may have physical disabilities arising from conditions such as congenital deformities, spina bifida, or hydrocephalus, muscular dystrophy, cerebral palsy, brittle bones, hemophilia, cystic fibrosis, or severe accidental injury. Number 1. Visual impairment. Visually impaired may be defined as those children who suffer from the impaired conditions, difficulties, and deficiencies present in their visual organs which make them different from children with normal vision to extent of requiring special education provisions. For example, inheritance of our parents or accidentally happens. There are types of visual impairment. A. Hyperopia. Can see objects of far away but not near. Cause size of eyeball is too shorter. In short, far-sightedness. B. Myopia. Can see objects of near but not far. Cause size of eyeball is too longer. In short, nearsightedness, opposite of hyperopia. Astigmatism, cause irregularity in cornea or eye surface, cannot focus at one object regularly. Number 2. Hearing impairment is defined by IDEA as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. In contrast, a child with a hearing loss can generally respond to auditory stimuli, including speech. Occurs when there is a problem with or damage to one or more parts of the ear. Conductive hearing loss results from a problem with the outer or middle ear, including the ear canal, eardrums, or oxicles. At A. That's a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without application that adversely affect a child's educational performance. Letter B. Hard of hearing, an impairment in hearing, whether permanent or fluctuating, that adversely affect a child's educational performance, but that is not included under the definitions of deafness.
Speech impairment. Speech impairments are disorder of speech, sound, fluency, or voice that interfere with communication, adversely affect performance in or functioning in the educational environment, and result in the need for exceptional student education.
Speech impairments can make it hard to communicate. Someone with a speech impairment may have trouble with articulation, voice, and fluency. Some kids and teens with speech impairments have oral motor problems. This means there's inefficient communication in the areas of the brain responsible for speech production. Speech impairments also can be part of a more general developmental delay related to medical conditions such as hearing impairment, weak muscles around the mouth, cleft lip or palate, vocal nodules or hoarseness, autism, or breathing or swallowing disorder. Stuttering or stammering is a problem that interferes with fluent speech.
Lisping is an articulation disorder. It refers to a specific substitution involving the letters S and Z. A person who lives replaces those sounds with TH.
Students with speech impairments may feel nervous, embarrassed, and frustrated when they're talking in class, have to miss class time to attend speech therapy programs in or out of school, use relaxation techniques to help them speak more clearly, need more time to answer oral questions in class or for tests, need seating accommodations such as sitting in a front row if their speech problems are related to a hearing impairment, use assistive technology to better communicate in class.
Multiple physical impairment. Multiple physical impairment means concomitant, simultaneous impairments, such as intellectual disability blindness, intellectual disability orthopedic impairment, etc., the combination of which causes such severe educational needs that they cannot be accommodated in a special education program solely for one of the impairments. The term does not include deaf blindness. Students with multiple impairments have more than one disability in cognitive, physical, and/or functional abilities. They typically require intensive intervention and support for activities of daily living. Causes of multiple disabilities. Having multiple disabilities means that a person has more than one disabilities.
With some children, however, the cause is known. Other causes can include chromosomal abnormalities, premature birth, difficulties after birth, poor development of the brain or spinal cord, infections, genetic disorders, injuries from accident. Multiple disabilities aren't all the same. The term multiple disabilities is a general and broad. From the term you can tell how many disabilities a child has, which disabilities are involved, or how severe each disability is.
Children with multiple disabilities will need some level of help and support throughout their lives. How much support a child needs will depend on the disabilities involved. A child with mild multiple disabilities may only need intermittent support, meaning support is needed every now and again or for particular tasks. Children with multiple for more severe disabilities are likely to need ongoing support.
Next, let us talk about the learners who are gifted and talented.
Term gifted and talented, when used with respect to students, children, or youth, it means the individuals who gave evidence of high achievement capability in such areas as intellectual, creative, artistic, or leadership capacity, or in specific academic fields. Gifted means having exceptional talent or natural ability, while talented means having natural aptitude or skill for something.
First, music. Musically gifted children often sing or hum a melody that they had heard somewhere earlier. Their brain seems to be especially good at absorbing and remembering musical information, and they derive a lot of pleasure from recreating it for themselves as well. What are the signs that the child is musically gifted? First, musically responds movement. Second, responds to good and bad sounds. Third, hearing songs or melodic ideas all around. Fourth, instrument playing by ears. And fifth, picking out harmony lines. Second, visual arts. Visual arts are art forms that create works that are primarily visual in nature, such as ceramics, drawings, paintings, sculpture, printmaking, designs, craft, photography, video, filmmaking, and architecture. Visual arts in early childhood is a way for children to connect, identify, and construct their cultural identities through learning and activities that relates to their interests and experience, further encouraging their development and participation in art.
Third is intellectual giftedness. When we say intellectual giftedness, it is an intellectual ability significantly higher than the average, on which the achievement of learners are so outstanding that their educational performance is adversely affected. In short, intellectually gifted individuals see things others don't see, understand equations others cannot comprehend, and imagine solutions to problems the world unsolvable. There are two classifications of being intellectually gifted. First is general high ability. This refers to exceptional capability or potential recognized through cognitive process. Example, learners who have striking talent for both mathematics and language skills. Second is specific ability. Ability used only for a particular intellectual task. Example, learner may have striking talent for mathematics without equally strong in language skills. Such ability of intellectually gifted learners is a result of an interaction between child's genetic endowment and a rich and appropriate environment which the child grows. The fourth is performing arts. The learners who are talented in performing arts show a potential to perform creative activity using their own face, body, and presence in front of a public audience. The major types of performing arts include music, opera, dance, drama, and spoken words. From that types of performing arts, we will notice that body movements and presence are the major elements in performing arts compared to visual arts that creates works primarily visual in nature. Lastly, in performing arts, the child can also encourage to explore their emotions, expand their imagination, and to express themselves more effectively to others.
Always remember, having a disability and special needs is not easy. But if everyone supports this kind of learners, they can improve, and one day they can be successful. According to Martina Navratilova, disability is a matter of perception. If you can do just one thing well, you needed by someone.
Thank you. Thank you.